time being 8:15, the House Human Service, Finance, and Policy Committee will come to order. And we'll begin by approval of the minutes. Representative Knorr, being the first member here this morning, would like to move the minutes from Tuesday, February 24th, 2026. Are there any additions, corrections, or changes to be made to the minutes? Seeing none, all those in favor of adoption of the minutes from February 24th, 2026, please signify by saying aye. Aye. Opposed, same sign. The motion passes and the minutes are approved from February 24th, 2026. At this time, the first order of business will be to take up House File 3378, and I will be moving House File 3378 to the Judiciary Committee and changing gavels so I can talk to everybody from that side of the room.
Hello. Good morning. What was that? Just say that. All right. Good morning. Chair Schomacker, to your bill.
Thank you, Madam Chair. The bill that we have to consider this morning is House File 3378, and it's just taking the report that we'll be talking about in more detail in a little bit and taking out the redacted portions. Anyone who read the report saw that there were several black boxes throughout the report citing Minnesota Statute Chapter 13.37, and there was concern with that and how much was being redacted and what was being redacted, especially from the legislative standpoint. Maybe it matters less to people of the general public, but for legislators, the things that were redacted were things like general vulnerabilities or policy recommendations. And for us as legislators to be able to assist in the department's work or help direct them in the work that they should be doing, we need to know what they know on the programs there and how we can be helpful with that. And I would just say that from my perspective, and the reason that this bill was being offered is that we have these same kind of reports, different areas, but the same kind of type of report that the OLA does for us all the time, and we don't see redacted information in those reports. And so for those reasons and the short window that we have this year, I wanted to move these along sooner rather than later so that we can understand what potential fixes that we have, what solutions we can come up with before too long. And with that, I would turn it over to the committee.
Wonderful. I'm first going to ask, is there anyone else who wishes to testify on House File 3378? All right, discussion from members. Chair Knorr.
Madam Chair and members, Mr. Chair, I just wanted to inquire if we can get setting from, I think the agency have seen 2 presentations here before we pick up the bill and send it to Judiciary. Is that feasible?
Mr. Chair.
I'm sorry, I kind of missed that, Chair Knorr. Could you repeat that?
I just wanted to take a little bit of a deep dive into this bill and the Optum report, because I see that we do have a presentation from the agency so that we can have a deep dive and discussion as we move the bill forward to Judiciary.
Chair Schomacker.
Okay, so the request is to hold on voting for the bill until we've had the presentation, or?
At least get an understanding of the whole concept so that people are aware of why we're requesting the reduction.
I am amenable to that, Madam Chair.
Wonderful. All right. We will table House File 3378.
All right, thank you.
Wonderful.
And I'm back. Next on the agenda is a presentation from the Department of Human Services and from Optum about the report that we have in question. And so ask them to make their way forward. And take your time getting settled in, and whenever you're ready, please introduce yourself for the record and present your report.
It's Green Bay, so like Michigan. Just wait for him to queue. Just wait for him to queue.
Whenever you're ready.
Chair Schomacker, members of the committee, thanks for having us today. I am John Connolly, Deputy Commissioner and State Medicaid Director at the Minnesota Department of Human Services. We're here today to talk through a few items with respect to prepayment review, the enhanced prepayment review process that we recently implemented, and some of the work with Optum, our vendor, who is a part of that process. And we have representatives from Optum here with us today as well to answer questions. We'll move on to the first slide here in the presentation. So the first thing to note here is that all of this is happening in a backdrop of the Centers for Medicare and Medicaid Services engaging us very assertively and requiring a number of actions from us. Those have been requested both in letters on December 5th, 2025 and January 6th, 2026, requiring again that we submit corrective action plans outlining our different plans, milestones, intentions to execute the different items that they requested. We also included a number of additional items that the department and many partners in our service delivery systems feel that are important for us to include in a corrective action plan speaking to program integrity concerns or gaps. So I will just note on this slide before I move on, we are working as aggressively as possible to achieve all of the different action items included in the corrective action plan on the timelines that CMS has either requested or directed. And we are on track in that regard with respect to a number of items, and most of the timelines are in the first half of calendar year 2026. And we'll say more about some of the actions involved in that in this presentation, and of course, happy to answer questions at the end here about those various items. So one point to make that's really important with respect to saving access to Medicaid services, Medicaid funding, particularly federal Medicaid funding, is that it hinges, of course, as a result of this corrective action plan on program integrity and enhancing program integrity in the programs. The department has taken these actions, the administration has taken these actions out of a really an imperative to protect the program, the benefits, the services, the members, and the provider networks. So overall, our goal with all of this is to become the best state in the nation for Medicaid program integrity. We are, again, acting aggressively to become the best state, and according to our awareness, we are doing more than any other state in this regard to strengthen program integrity in the Medicaid program. A few items here on this slide to mention, of course, the Governor's Executive Order 2510 and the different items included in that. Many of those are also reflected in the corrective action plan that we've submitted to CMS. We're still awaiting approval on the January 30th submission, and we'll certainly notify the committee when that happens or any revisions that we need to make at the direction of CMS. There were a number of other actions taken in roughly the last year and a half, including identifying 14 high-risk services, auditing autism service providers. We talked a bit about that, of course, earlier this week at a different committee hearing. Ending the Housing Stabilization Services Program, establishing a moratorium on adding new service providers in the 14 high-risk services. I should note that was at the direction of CMS. Also enhancing prepayment review processes. Optum is here to talk with us about that today as well, for the 14 high-risk services on the fee-for-service side of the program. Also reviewing and revalidating providers, all providers in those high-risk services, the 13 remaining high-risk services, by the end of May at the direction of the Centers for Medicare and Medicaid Services. And then finally, item 1G in the Governor's Executive Order 2510, reorganizing DHS to increase program integrity and really organize ourselves as the department responsible for operating the Medicaid program. Next slide. So a few things here just to highlight why DHS engaged Optum for this vulnerability report. We needed enhanced prepayment review really to prevent the pay and chase approach that we have always really been engaged in at DHS in terms of program integrity. Post-payment action occurs, of course, after providers receive the payment and some sort of investigation or audit has occurred, and then there's an effort to recover money. This is to kind of flip the script such that we are looking at claims before they're paid and with the ultimate intention of preventing fraudulent actors from receiving payment altogether and getting ahead of that with a enhanced prepayment review process. I should note there were claims edits in the system, MMIS, our claims processing system, ahead of this implementation of enhanced prepayment review, but this greatly strengthens our actions in that regard. In addition, the vulnerability report also includes a series of recommendations, and I think similar to us working with the HHS-OIG or with CMS, we're also working with an external vendor to review what we're doing, to take a look at our claims, to take a look at our provider manual, our policies, our program design, and tell us areas where we could revise. I should note this report is a single milestone. The analytics, the recommendations, the potential savings figures in the vulnerability report are a point-in-time understanding and reflective of 90 days of work. This is not a finished product. We have to refine our work with Optum, and we're continuing to do that. The analytics that we've been using in enhanced prepayment review are evolving. They have changed every 2 weeks according to our conversations and the way that we've kind of dug into the analysis that Optum has done. The same will be true of the recommendations that are in the report, some of which we might be able to implement administratively, others we may need to come to the legislature in partnership to implement program or policy changes. But again, this is a point-in-time understanding based on the 90 days of work that Optum did with us, and we will revise these understandings, and some things we will amend, some things we will take, some things we will leave. I should note, again, that our teams continue to dig in as we receive results that will help us understand better. Perhaps an analytic, like I said, may have a threshold that we could tweak or refine, or a different structure to it that might be more beneficial based on the structure of the program, the provider network, or the different types of services involved. So we'll continue to refine those things. Next slide. So what's involved in enhanced prepayment review as we've implemented it? As I mentioned, we identified the 14 high-risk services that are included in this process. I'll note also as a subpoint here that we intend to expand this process to all services in the fee-for-service side of the program, in addition to working with managed care organizations under contract to engage in enhanced prepayment review in the same manner on that side of the program and through those contracts. So first in the process, the vendor then performs the prepayment analysis on the claims for those 14 services, and they will flag based on the analytics they're using. I think we're up to about 90 at this point. I'll check that number, but it's in process. It is increasing every 2 weeks as we apply more and more analytics to the program. But I think we're approaching 100 analytics at this point and may reach above 150 when we're at cruising altitude, so to speak. So after about 5 days, then they will send their findings based on those analytics to our policy teams, our programmatic folks within DHS, to take a look at the flagged claims. And then each and every claim will go through a review within those teams to look at whether or not it in fact seems appropriate or is appropriate. But if there are questions, then the policy teams can follow up with providers to get additional documentation, follow up with members to interview them and understand their receipt of service, and try to verify with that information that billing was appropriate. If there are enduring program integrity concerns after that process, then those claims, if they're still concerning, could be referred to the Office of the Inspector General within DHS for further kind of program integrity investigation and review. Next slide. I'll be brief here since I went through a lot of this in my prior comments, but a little more detail or texture with respect to the enhanced prepayment review. So that first step takes about 5 days on the Optum side to do the analysis to flag the claims that could potentially be concerning. And again, I say potentially. Some will turn out to be concerning, some won't. Then DHS takes about 5 days to review those flagged claims. Although I should note, some will be released within the regular 2-week kind of rhythm. So we have 2 weeks in which we can review the claims and release them for the next warrant cycle or payment that goes out to providers. That happens every 2 weeks. Some, if they're held for further review, could take more time. And so we have up to 90 days for those claims to review with the providers if there are problems potentially associated with them. And then, of course, if they're referred to the OIG, it could be a longer time frame. But the vast majority of claims so far have been released within that 2-week review period. Of course, unflagged claims will all be paid within that 2-week time frame. If there are no concerns with them, they will be included on the payment with the next warrant cycle. I should note, again, there was a delay of 2 to 4 weeks, depending on when providers submitted claims around the time when we paused claims on December 23rd to implement this process. That pause, we understand, was very challenging for many providers. We've heard a great deal of feedback from you all and from providers, and have worked hard to release claims timely since we were able to resume this biweekly payment rhythm, so to speak. And certainly understand when we hold claims for further review or investigation that providers, they are, of course, dependent on the payments in many cases. Many of them are Medicaid providers, or a vast majority of their claims are in the Medicaid program, so we understand the impact of holding claims for further review, but of course being mindful of program integrity at the same time. So we hold those two imperatives in tension. I think the last thing I'll just note here on this slide too is that every 2 weeks we are paying providers now, but historically we've paid providers within 5 days of the close of that warrant cycle. Now it's 2 weeks later to allow for the process that I described. But providers are now getting paid every 2 weeks after that initial pause of 2 weeks for some providers, 4 weeks for some others. So since January 27th, we've been back on that biweekly rhythm. All right, let's move to the next slide. This is, it's busy, I'll admit, but we just wanted to make sure we gave everybody the texture here in terms of the warrant cycle, as we call it. That's the biweekly payment cycle. And I'll draw your attention to the January calendar here. And you can see the 13th was the date on which that first tranche of payments that were held for 2 weeks with the implementation of the prepayment review process went out. So that was about 60% of the claims and that payment period. And then the remaining 40% went out by the 27th, along with the payments for the subsequent warrant cycle. But since then, we've been, in February, we've been back on that biweekly payment cadence. But the payment providers are receiving is from 2 weeks in arrears to allow for the enhanced prepayment review process. Next slide. So we've also had a lot of conversation with providers, with counties, and with you all and other partners, advocates in the system, understanding the disruptions that this all is causing. We know that these changes, that enhancing program integrity is disruptive, and we want to do our best, again, to hold our imperatives in tension, to make sure that we're upholding program integrity, making sure that taxpayer dollars are supporting services, real services for people that need them, but also making sure that actions that we take, as much as we possibly can, do not threaten the safety and health and well-being of the people that we're serving. And so we implemented a Safe Transitions Framework in November 2025, which involves a 2-week delay with respect to integrated community services in particular. Residential services are in particular focus here, given that people are receiving services in the places that they live. And sometimes there are providers that offer both housing and service and are reacting to the payment withhold actions that we are taking as a result of that. So with that 2-week delay, it gives leadership at DHS and staff within the policy areas the opportunity to reach out to lead entities, counties, the agencies that are under contract with them, and tribal nations to give them information about the people in those facilities and who's impacted by these actions so that they can act to provide continuity of care, safe transition support, whatever those folks need, those program members need to safely transition when there is a payment withhold. We are continuing to be in contact with counties about this. We're receiving feedback from providers, from provider associations, and others, advocates in the community about instances of people that need support. And so we are also stepping in on our side, and I'll say a bit more about that on the next slide. But we want to make sure that folks have what they need and have continuity of service. So with respect to the difficulties that have been raised to our attention, and we've had a lot of conversation with many of you about that, we also leveraged the enhanced complex transitions process. We have an existing complex transitions team within DHS that's funded to primarily support transitions from hospital or institution-based settings to community, and there's federal funding for that. And so what we've done is repurpose a bit of that capacity with state dollars to support this kind of work if there's transition from a community setting, one ICS provider, for example, integrated community supports, to another. So if there are concerns or issues, challenges with respect to lead entities and their contractors, we are available to step in and help folks either provide support to the lead agency or to provide support directly and engage with providers so that folks, again, have continuity of care. Next slide. A few more things about improving provider and advocate engagement. I think it's necessary at this point for us to acknowledge this hasn't been perfect. We have made mistakes, and our commitment is to be present, to take feedback about how we're doing this work. Again, enhancing program integrity and providing access and continuity in terms of service are imperatives that are in tension. We feel that all the time, and we're doing our best to balance those things. And again, we haven't done this perfectly, and we're trying to be present for the conversations, for the feedback, and improve the way that we're doing this work, both in terms of enhancing program integrity, but also supporting people. That's a primary element. They're both primary elements of our mission. So after receiving feedback from providers, from advocates, and from you all, we've taken a number of actions, and I'll start with some existing things that we've done to engage and communicate with providers, and then some things that are new, just based on the feedback that we've received. So we do have direct system notifications through our minute system. Some of you may have heard about that. And we understand that that is one way that some providers really monitor information from us, but we've heard very clearly it's not sufficient, that we need to explore new and other ways, multimedia, to engage, and different forums to engage with providers. And I'll say more about that in a minute. We also have email updates, of course, public website information, but that requires people to go there. In addition to our provider resource representatives that can answer questions over the phone, we've also heard, and we know from our own experience, that they are overwhelmed too, given all that's happening with revalidations and transitions in care as a result of the program integrity actions that we're taking and have been directed to take. So want to acknowledge that as well. And we're trying to work to support them and provide multiple ways for providers and for folks in the community to access the agency and our experts. So in addition to those existing forums, there are a couple of new things that we've also developed to engage with providers and seek feedback. The first is implementing a weekly roundtable with providers to hear about how things are going, to hear concerns, feedback, try to enhance processes. That is, again, weekly. We've had historically provider roundtables as a result of the unwinding process, and have tried, that's the redeterminations that we did at the end of the public health emergency with respect to program eligibility, rather, not integrity. Although that's an important point, or a piece of program integrity, I should note. So providers can ask us direct questions there, and we'll take their feedback. And in addition, in that vein, we also have an advisory panel of providers and associations to vet provider communication. So if we put something out and we think it's snazzy and straightforward, but providers are saying this does not hit the mark, it doesn't make sense, it's not going to help us, we take their feedback and we try to do better. In that vein, so improving quality of communications, we have a weekly provider newsletter to share key messages. Again, just trying to over-communicate and communicate in a way that makes sense to providers, again, based on feedback. Using visuals and videos, these were things that providers asked for. They said, written communication, the communication through minutes, it's not doing it for us, so we need more and different ways of engaging. Step-by-step tutorial videos that are evergreen remain on the website that people can access on their own time. And again, just making sure that we're messaging internally. We are a large organization, well over 2,000 employees, and making sure that folks have the information they need increasingly. And again, we're not doing this perfectly, but doing our best to make sure that we're bringing our staff, our teams along, so information's consistent, such that no matter how you access us or communicate with us, that we're saying accurate and consistent things. I think, that is it. So I will pause, and I'm happy to stand for questions.
Director Connolly, thank you for the presentation this morning and what you have to offer us. And if you could just please stay there for a little bit of time yet. We'll go to Mr. Dreyfall from Optum, and just thank you for coming in this morning. We appreciate you making your way in to help us understand this process a little bit more and understand, of course, that you are the subcontractor for the department, and so it's helpful that the department's here for the questions that may come up that you can't answer or aren't allowed to answer per your contract. So welcome to the committee. Thank you for your time this morning. Please state your name for the record and present your testimony.
Thank you, Chair Schomacker and members. Chair Norris, great to be here with you this morning. Thanks for the opportunity to speak with you this morning. My name is Jason Dreyfall, and I serve as the State Government Programs Lead at Optum. Optum was retained by the Minnesota Department of Human Services in October of 2025 to analyze Medicaid fee-for-service claims data across 14 high-risk programs and flag potential issues for DHS review. Optum has more than 25 years of experience supporting program integrity efforts in many states, bringing distinct know-how along with prepayment integrity assets designed to assess risk, large volumes of claim activity, while operating within state-defined rules and oversight. Beyond our technical expertise, we bring deep commitment to our mission to help make the health system work better for everyone. Optum is headquartered here in Minnesota, and we are proud to support the integrity of the public programs that serve the people of our home state. Our contract with DHS is structured in two phases. Phase 1 focused on conducting a vulnerability assessment of 14 defined in-scope programs, helping DHS better understand areas of potential risk and opportunities to strengthen prepayment controls. Phase 2, which is currently underway, involves supporting prepayment analytic processes under DHS oversight, using Minute and DHS system data. It's important to note that under our contract, Optum works with DHS by identifying indicators of potential fraud, waste, or abuse for claims within those 14 in-scope programs that may warrant additional state review. Our work is analytical in nature, and our reports do not contain conclusions or determinations regarding fraud, waste, or abuse. We do not determine eligibility, approve or deny claims, or take enforcement or adverse action. All decisions and authorities remain solely with DHS. Given the nature of this work, I can speak today to our contracted scope of work, general capabilities, and experience supporting state program integrity efforts. I cannot speak to individual cases, confidential data, internal state decision-making, or what DHS has determined to be protected from public disclosure. Again, thank you for the opportunity to be here today and speak about the nature of our work with DHS. Thank you.
Mr. Dreyfall, thank you for your opening remarks here. Members, we do have the reports from Optum in our packets today. I don't know, we didn't ask anyone to prepare to walk through the report as far as I'm aware, and so we won't do that, but I'm sure everyone's had a chance to read through them, and so we'll open things up for questions. Let's get to it. Representative Hicks.
Thank you all for being here. I am frustrated with this process for a variety of reasons, but I'm going to start with the fact that neither the department nor Optum seems to have taken into account medical necessity throughout this process. So I'm going to have some pointed questions for both the department and Optum. So first of all, for Optum, you said in phase 1 that you were just creating analytics. Is that correct?
Mr.
The
Dreyfall.
Phase 1 portion of the work is a post-pay analysis, so we run analytics over those 46 months of data. That's correct.
Thank you.
Representative Hicks.
Thank you for that. And the decision about what to do with that information rests solely with DHS. Is that correct?
Mr. Dreyfall.
That's correct, Representative.
Thank you.
Representative Hicks.
Thank you. In our 14 programs, that are being looked at in most of them, the statutes say things like medical necessity throughout many of our programs, or min choices assessment results, or whatever the qualifying criteria is for each of the programs. In those 14 programs, many have service authorizations that required proof of that statutorily outlined criteria. How do your analytics account for those service authorizations, medical necessity, or min choice assessment data? When you're looking at those, when you developed the analytics, how do the analytics interact with the statutory mandated qualifiers?
Mr. Drapel.
I really appreciate your question and the opportunity to explain the process a little further. So the way our capability works is that we have a policy to analytic generation tool. So we call it a policy to SQL analyzer. So what we're doing is we take the state policies that exist today. So to your question, if that dynamic or requirement is within the state policy, it would get captured in the creation of that analytic, and then it would be evaluated in our process accordingly. So our analytic engine looks at state policy and then creates the analytics that evaluate that post-pay claim activity through that lens. That's exactly how it would work.
Representative Hicks.
I love that. Then can you tell me for, let's pick EIDBI, for example, as it is my favorite, and according to your report, I don't think the analytics are right because the math does not math. So let's pick EIDBI. The Minnesota statute, so I'm not even going to talk about policy because policy is the department's problem. Statute is our problem. So the statute says ASD or related condition, continues to chat a little bit about the DSM, and then it says the following criteria. And there are 4 subdivisions and 5 subdivisions under one of those 4 subdivisions. So what DSM billing codes were used in your analytics
Mr. Drapel.
to meet that statutory requirement?
Representative Hicks. Mr. Drapel.
I'd be happy to spend some time outside of the committee hearing to go through some of those specific dynamics with you.
That's fine.
Okay.
We can do that. So
Representative Hicks.
here's why I'm angry, because no one can actually answer those questions for me. And I seriously suspect, based on what's in your report, that they're wrong. So here's the other place I think they're wrong. Actually, I think they're wrong everywhere, but let's just pick a few. The statute also says clinical supervision is responsible for including individual treatment planning, staff supervision, individual treatment plan, progress monitoring, treatment review for each person, and that it is provided by very specific people. That's what the statute says in the definition. So do your analytics for clinical supervision and ITP, progress monitoring, allow for individual treatment planning, staff supervision, individual treatment progress monitoring, and treatment review for each person?
Mr. Drapel.
Thank you. As I explained earlier in the process, we would evaluate the state policy and we'd use that to build the analytical engine that's used today. So the root question would be the reference of that within the state policy and guidelines that are used to develop that analytic.
Oh, I love that answer.
Representative Hicks.
So I want to be clear that I'm understanding what Optum just said. So you just said that you're going to use the state policy, which in theory, Mr. Connolly, should be based on statute. So when you bring me further information, it's going to clearly indicate that your analytics accounted for staff supervision, individual treatment plan progress, and treatment review for each person? Is that what you're telling me? That is going to be clearly in the documentation that was used in phase 1?
What I'm telling you
Drapel.
is that the analytics that are developed and being used presently are based on those state policies that are in scope for the analytics in the programs that we evaluated. So that is how the system works today.
Thank you.
Representative Hicks.
Mr. Connolly, do you agree that with Optum using what they just stated during phase 1, that their analytics are in alignment with statute and policy?
Director Conley.
So, Chair Schomacker, Representative Hicks, so 2 things. I think the first is that there has been a change since the initial set of analytics that were applied that produced the figures that you're talking about in terms of how they're used in the enhanced prepayment review process. So currently, the only analytics that are being used in that biweekly process are what we call direct policy analytics that do reflect what's in the provider manual and state policy. Some of what was associated with the 90% figure that you're highlighting were other types of analytics based on input about billing thresholds or interactions of services. So not speaking specifically to the individual treatment plan, the authorizations that are required for EIDBI, and those are really indications of areas for the department to look more closely or with scrutiny at some of the claims above that threshold. I will agree to your point, though, to the point of medical necessity. I made this point at the committee hearing on Monday, too. Some families and children have complex needs that require that level of clinical intensity, and so we need to be careful and look closely at that billing.
Representative Hicks.
Thank you. I appreciate the admittance that the analytics were not in alignment with statute. That's helpful. I also want to talk a little bit about medical necessity. So many of these programs have in-depth criteria for qualification and creation of service authorizations. And in both the fee-for-service side and in the MCO side, we have very specific criteria about who has to have the right certifications to determine medical necessity. So the part of this that is just is so frustrating for me is I don't know if anybody has ever had to go through a prior authorization, but it is an exhausting experience. And in some of these 14 programs, there are service authorizations, which in Medicaid terms is a service auth, but what it really is a prior authorization. And so they have to be approved and they are reviewed by people with certain medical criteria. They are county social workers in CFSS and PCA. Those are your county workers who approve those plans based on min choices. They are BCBAs in EIDBI in the fee-for-service and at the MCOs that are paid to review plans and determine medical necessity and make adjustments if the request is too big, too small, has too much of this, not enough of that, whatever it is. They are your mental health professionals in IRTs who determine that someone needs that level of intensive residential care because they are having a psychiatric crisis. And none of that is accounted for in this process. And instead, a report is issued that undermines all of those professionals and they don't account for them. And you just admitted never took into effect many of those requirements. So as someone who doesn't believe that AI and bureaucrats should determine healthcare, but that those determinations should be between professionals and families, I am irritated. And I remain irritated because I think we have taken the people out of this conversation. And it is machines and AI that are determining medical necessity, and not even medical necessity, because they aren't determining medical necessity. That at this point is still happening by people for now. But they are determining how effective our programs are without ever looking at people.
Thank you, Representative Hicks. Did anyone want to follow up on anything that was stated there? Director Conley.
Chair Schomacker, Representative Hicks, I appreciate those comments. And as you said, at this point, medical necessity is determined by the professionals that are charged with that. The process that we have in place is to look at billing that is flagged by certain analytics that are associated with the policies that we have. And so at this point, our policy teams, our programmatic teams are looking at claims that are flagged and reviewing them and then corresponding with the providers to confirm that the billing was appropriate. That is the process that we have in place, and we seek to respect the different elements of the delivery system, the statutory frameworks we have in place with respect to authorization and clinical professionals.
Thank you, Director Conley. Representative Gander.
Thank you, Mr. Chair. It's interesting because the question I was going to ask and any comments I was going to make would relate closely to what Representative Hicks had shared. I've heard the criticism of this whole effort. It's just AI. It's not even real. We spent a lot of money. We got a report. It's just AI. It's not even real. And I will say I'm really glad we're using AI and every tool in the toolbox as a first pass to flag these outliers, right? We had, we won't go into the specifics, but we had vendors in the last 5, 6, 7 years that now you look back on them after the fact and say, how did we let that happen? How did we spend $250 million on this? And you get the idea. So there are statistical outliers that should be able to be picked up with AI, and I want every tool in the toolbox brought to this. Would you please, we know about the AI part of it, and we don't need to know all your metrics and all the things, because again, some of that is proprietary. But would you please just go a little further to convince us that when these are flagged by something AI-driven, that there's a human component that goes in and mops those up? Will you spend just a little more time convincing us of that human component that fully utilizes the excellent tool of AI and then brings it back to what we all want, and that's good outcomes for our residents? Thank you.
Director Conley?
Chair Representative, thank you for the question. So yes, we can affirm that there is absolutely a human element in both the selection and the design of the analytics that are used. So we are corresponding continuously with Optum to refine the different analytics based on what we're finding, based on policies that we have, and the design of the benefits. So that's one piece of human input and a continuous improvement process that we're engaged in with Optum. Then on the second part of this process, so that's the first 5-day kind of analytic part of the process. And then when the claims come to DHS, the program teams in the different policy administrations, so aging and disability services, healthcare, behavioral health, homelessness, housing, and support services, they'll review all of the claims and look at them to see if they make clinical sense. And if they have questions, they will correspond directly again with the providers and with the program members if needed to confirm that the services were delivered, they were delivered appropriately, the documentation supports them. And if that's all true, then we release the claims for payment. And many of the claims are being reviewed, most so far, the vast majority, I should say, within the 2-week warrant cycle or payment period, so to speak. Some are being, several hundred have been held so far in the past. I think we're in our 5th prepayment review, enhanced prepayment review cycle now, have been held for further review longer than 2 weeks. And there's been engagement with the providers about those. And again, then if there's a concern that endures after that, all of that work has been done, then there would be a referral to the Office of the Inspector General for a program integrity investigation.
Representative Gander.
Thank you, Mr. Chair. One quick follow-up. Is there any part of this sequence that would trigger an on-site review for that provider, for that vendor?
Certainly. That could happen if the program teams decided they wanted to go on site to review documentation or interview staff. It could also happen, and often does happen, with the Inspector General process where they investigate more enduring or serious issues with respect to program integrity or fraud concerns.
Representative Gander. Representative Curran.
Thank you, Chair. Thank you for being here today. I want to ask just maybe 1 or 2 more questions about the use of AI. And this question is directed for Optum. How has Optum reckoned with the use of AI to deny pre-authorizations when data demonstrated a roughly 90% error rate?
Mr. Dreyfus.
Thank you for your question. I appreciate it. Today I can speak about the 14 programs that we're delivering for the Department of Human Services. The scope of your question, if you want to clarify it, it doesn't really apply, I think, to the work we're undertaking here with the Department of Human Services.
Representative Curran.
Yeah, thank you, Chair. I'm referring, Representative Hicks had brought up analytics already and EIDBI. I think this is what we're talking about. I'm trying to find out how, if the state has hired Optum to do this work with 25 years of experience, knowing that there is a high rate, a high demonstrated error rate. I'm curious how that affects Optum's response and deliverables in this process.
I really appreciate
Mr. Dreyfus.
I really appreciate that clarification, and maybe this process-wise, maybe this will help from how we're using technology and AI to the representative's comments earlier. Where we're using that technology is to convert the state policy into the analytic that we run. So that's what's happening. And then the output of that was, I think, described earlier, moves to the Department of Human Services for all the reviews that were just discussed and the work that happens after that. So with respect to your question, Representative, the technology or tool or AI is used in that policy to SQL generation. The flag occurs, and then DHS receives that information and initiates the appropriate follow-up, determination, conversations, things like that that need to happen. So when you talk about error rate, that would apply to what's happening with respect, I guess, to the follow-up. I mean, it's a little bit of a different application, I think, with your question.
Representative Curran.
Thank you. So then what factors are considered when a claim is flagged as potential fraud?
Mr. Dreyfel.
Thank you for your question. So when we generate the state policy to analytic, the analytic will run over the population of claims that are being evaluated, and then flags will be generated. I don't want to speak to areas of the report that may be redacted, but just in general, relative to those analytics, they could be things like, just hypothetically, they could be things like impossible days. So for example, in an analytic like impossible days, you'd say, well, I'm supposed to provide, up to 30 hours of services a week for something, and the claim will flag and say, well, 40 hours were provided. Or it's called template billing, where you'll see just 40 hours, 40 hours, 40 hours provided. So it might flag that. All the flag means, Optum isn't making any determination of fraud, waste, or abuse. We're generating a flag, and then DHS appropriately follows up and takes action with that and makes a determination about whether the claim should be paid, what follow-up should occur. But that's at a very general level how the analytic process works and how technology is being applied.
Representative Curran.
Thank you, Chair. Thank you for those answers. I think what we're highlighting on both sides here is that the intelligence that AI offered to this process is indeed artificial. We need to have the people who are policy experts involved in developing a system that's complex like this. There are certainly things that we can do on very simple basis to use AI that, is potentially, you could call maybe a waste of humans' time, right? Like very, very, very simple things. But what you pointed out, to the point of somebody systematically billing 40 hours, if that person is in need of 80 hours and all they are allowed is 40, I can assure you that every single time that person is billed for, it's going to say 40 hours because their needs exceed what the state has allowed them to receive. So while there are cases where systematically billing the same amount is fraud and could be fraud, the very real picture of services delivered in the environment that we're in, especially here in Minnesota, with the very few resources we have to offer people in the first place, especially when this body has decided to cut funds to vulnerable people, if they only have a certain amount of hours available to bill for, they're going to bill for 100% of the time, every single billing cycle. And what I'm hearing is then that's turned over to DHS and deemed appropriate to withhold payments because of some kind of pattern. I would disagree that then in that process, you mentioned Optum turns the data over to DHS, who then takes the appropriate action. I disagree with that statement. That's not on you. I disagree with that DHS has taken appropriate action. And that includes when it comes to developing these analytics and deciding how we're going to figure out if these claims are fraudulent, there seems to be a disconnect here too between not only between what state statutes and legislators are saying with the intent of policymaking, but then there are disputes behind the scenes between the Department of Human Services and the Office of Inspector General. And what concerns me with the sort of appropriate response to some of these things is I'm concerned that DHS has not pulled their experts in and pulled their policy experts in enough and allowed OIG, which is supposed to be the enforcement mechanism, to then make policy interpretation and policy decisions when it comes to developing analytics and how we're tackling fraud. I'm very, very concerned about the separation there. We have a legislature and we have the Department of Human Services for reasons. And the last thing we need anywhere is enforcement agencies also deciding what the policies are and then just deciding for themselves, or having a significant role in deciding what those policies are and then just going out and enforcing them and skirting the entire process that we're here for. So that's, I've got major concerns around what's considered appropriate to tackle this problem, and what's considered to be valid analytics that are very much artificial. I'm very curious, though, who at the state of Minnesota engaged Optum throughout this process to get them on board? That's for anybody who can answer it.
Director Conley.
Chair Schomacker, Representative Curran. So the entity that was mainly engaged in negotiating or engaging with Optum was Minute, but we were also engaged in that process at the Department of Human Services.
Representative Curran.
Thank you. Okay, so we're narrowing it down. We've been asking these questions for months, so I'm taking notes when we get a little slice here. How many versions of the contract were exchanged with the state, between Optum and the state, before refining the scope of the work and access to data on Minnesotans? Like, how many times was that exchange back and forth before the state decided to write our name, sign our name, and hand over money?
Director Conley.
Chair, Representative, I would have to get that information for you, but we can do that.
Representative Curran.
Thank you, Chair. I appreciate I don't appreciate that answer, I'm going to be honest with you. We sat in meetings that were outside of the public and asked these same questions. And this is why we pushed so hard for an interim hearing, was to avoid the precious time we have during active session to get some of these answers that the public deserves. I will tell folks for the record that when we asked those questions, we didn't get answers then. And what we know now in those private meetings is that the contract that was initially proposed wasn't reviewed. It wasn't changed. Not until a private meeting with legislators who said, hey, might you consider looking at the total scope of all of this data you're turning over to an entity? Might you consider that this is right for Minnesotans? Might you consider that private data will indeed be kept private? Might you consider that Minnesota's data on vulnerable people will not become part of Optum's business model that they then sell and apply to other states? We asked these questions behind closed doors in good faith to try to get these answers. And I'm not sorry that now we're having to ask them on the record. I would like to know, in those 25, this question is for Optum, in those 25 years of experience that you mentioned, how many credible allegations of fraud have been brought upon Optum or their parent company themselves?
Mr. Dreyfus.
I can speak today to the programs that we're delivering for the state of Minnesota, and I'd have to get back to you on that information.
Representative Curran.
Thank you, Chair. I think it's, folks can Google Optum, Department of Justice cases. If that's something that Optum's not able to say on the record, I'm certainly not barred from saying it, so I encourage folks to do their own research. So what this question, these couple next questions, and then I'll be done. Quick question to DHS. The Department of Human Services was really quick to call 14 programs as a whole that included really good providers providing very necessary services. Very quick to call all of these programs, all of these people serving our most vulnerable friends, high risk. Real quick to do that, and we can't take that away. But I have heard that there might be a process to then have programs fall off of a high-risk list. I'm glad to hear that. What are the plans to announce when certain programs do fall off of that high-risk list to highlight that they are no longer high risk, just as we highlighted that they are high risk?
Director Conley.
Chair Schomacker, Representative Curran, I appreciate the question, and certainly it is within the commissioner's discretion to designate a program as high risk or to remove a program from that list. CMS allows the state, and the state gives the commissioner the authority to do that. So I think as we engage further in the enhanced prepayment review process as we find out more with respect to investigations and as we advance the different controls around the program, many of which I think would be in partnership with the legislature, some of which I anticipate will be considered this session. We'll consider, the longevity of the different remaining 13 programs on the high-risk list. If I could, I'd like to say a couple other things with respect to earlier comments that you made too, just to be responsive. I think with respect to DHS and the OIG, we're one department. OIG is a part of us. I hear you that there may be cases in which experts have productive debate about things, and we're trying to arrive at the best ways to approach these processes, engaging all the leaders on our teams, including the policy areas that report to me. So I appreciate the feedback, making sure that we're all included in that process. That's certainly our goal and what we try to do. I know the policy areas have been more recently directly engaging with Optum too on their process, on their analytics. So the policy teams are engaged in the design of all of this, and they will continue to be. And that's important to me too, as the executive leader that supervises those areas of the department. On the data security elements of the contract, what I'll say is, there were elements, of course, in the contract. We did have engagement with members of the committee here and with legislators about that, took the feedback, and we're still engaged in good faith with you all on making those changes to the contract. So we certainly heard your feedback, and we hope that revisions to the contract amendments will be reflective of that.
Representative Curran.
Thank you, Chair. I know my colleagues have other questions to ask. I just want to very clearly state that the state of Minnesota is required to provide person-centeredness in all of that we do. This process that's been outlined today and over the past several months is severely lacking in the person-centeredness that we have all committed to, that's in our statute. And I really want folks to think hard about how we are treating people in this system, as Representative Hicks said, and I'll just leave it there. Thank you.
Thank you, Representative Curran. Representative Backer.
Thank you, Chair. A couple questions here. First of all, here's what's really confusing, okay? I'm not the best reader, but I'm really having problems with this. I just do. I mean, I could read this in the dark real well. And I am being sarcastic purposely, because how in the Sam heck can we do our job when we don't get this information? That's my first question. How can we do? It seems to me that the agency is opposed to getting us the right information. So like Representative Hicks talks about, we can provide better services because we have a fraud epidemic in your agency. Could you help me with that, Director?
Director Conley.
Chair Schomacker, Chair Backer, I appreciate the question, and we've received feedback universally from legislators on this topic about the redactions in the report, and we understand, frankly, we understand the frustration. I'll start by saying that we are doing our best to align with the Minnesota Government Data Practices Act. That's the first thing I'll say. However, in the interest of transparency, the release of the report was really hours after receiving the deliverable from Optum. So this was a very quick process with respect to redactions. We are taking another close look at the document to see what information we can release to legislators. And of course, both security and proprietary data are what are protected. So the main concern for us in the review of the document is that we're not releasing a roadmap to fraudsters with respect to different thresholds, analytics, recommendations that could give them a roadmap to thwart whatever processes or whatever hard-coded kind of claims rejection protocols we have in our system. So that's the concern. That said, I'll say we are seeking a way to provide information to legislators. We do want to share the information with you in a way that aligns with statute. Perhaps through individual meetings, but we're exploring what could be permissible. But we understand the frustration, and we do want to provide as much information to legislators as we can.
Representative Backer.
Yeah, thank you, Chair. So who has full access to this report?
Yeah, who does?
Who does? If we are the ones that send you the money, okay, because we approve it, so we write out the check and no, you can't see. This is like a parent. We're the parents. The kids, oh, I'm naughty, but you can't see why I'm naughty. This is why my constituents are frustrated. So let's make it simpler. Who has full access of the report?
So I'll start and
Conley.
Director
Please
Goff, feel
be
free to jump
specific.
in. Yes. So this is, again, just the interpretation I understand of statute. I'm not making any value statements here. That legislators under the Minnesota Government Data Practices Act are treated as the public. And that's, if folks want to amend that, that's for discussion. But we're trying to align with statute. We have provided a copy of the report to the Office of the Legislative Auditor. But we are bound by statute in terms of folks outside of the department who can have access to the unredacted report. CMS also has a copy of the unredacted report as, again, our federal oversight entity and a primary funder of the services.
Representative Backer.
Yeah, I'm also on a Minnesota statute, there should not be any fraud at all either. So I don't buy that answer because the question still is who has access? Does the commissioner have full access to the report? How about the governor?
Yes, they do.
Okay, so we got two. Who else? I'm sorry, Chair, who else?
So the Office of
Director Conley.
the Legislative Auditor has a copy that's unredacted, as well as our federal oversight entity, CMS.
Representative Backer.
I'm disappointed, but I know other members have questions, and you're here, you're being the scapegoat, unfortunately, somewhat. So has any of this report that we can't see, folks who are watching, maybe there's 3 or 4 people who are watching, has any of this been implemented in this report, Director?
Director Conley.
Chair Schomacker, Representative, none of the policy recommendations have been implemented yet. We're still digesting them. Some of them would require changes in statute, so we would have to bring those changes to you. So that's a matter for further kind of conversation and design. With respect to the analytics or other items with respect to the analysis, some of those things have been implemented through the enhanced prepayment review process. That's the 150 or so or 80 different analytics, depending on where we land as we review all of them and decide which to implement and which not to, or which to redesign. So some elements of it have been implemented as a part of the enhanced prepayment review process, but the recommendations broadly, no, they have not been implemented yet.
Okay, just one last
Representative
question.
Backer.
Thank you. Is there anything in this report, once it's finally disclosed, will raise additional concern in the public? Because we're the public. So what would raise additional concern? Is there anything in this report, this black line report, that would give additional concern to the public, Director?
Director Conley.
In honesty, that's hard to say because we did release the dollar figures of potential savings, and that obviously has provoked a lot of conversation and concern. And we're trying to be very clear about what those potential savings are and what they aren't. They're not figures related to fraud. This wasn't a forensic analysis of fraud. It's just an assessment of if DHS were to apply certain policy changes to the benefits, the programs, the design of them, that there are potential savings associated with those changes. That's what it's telling us. And then it's for us to really review whether or not we implement those things. And with respect to enhanced prepayment review, those aren't policy changes. They're just, it's a process for flagging claims for further review.
Okay. Just a comment. So thank you, Chair. It seems to me that the report would say, we have dollars, it goes to the right people instead of fraudsters. We're going to serve the public better. So very, very frustrated, like Representative Hicks, on this report. We can't do our job. It seems like the kids did a bad job and they're hiding it from mom and dad, and they think mom and dad's not smart enough to know that there's something that's in here that they're hiding. So thank you for
Representative
the
Frederick.
time.
Thank you, Mr. Chair. When we're talking about these programs, we're concerned about the fraud. And the reason that we're going through this process here is, one, to make sure that the money that we as a legislature allocate to these programs is going for its intent, is being used for its intended use, and that the people of Minnesota are receiving the services. So we need to have trust in that. I want to read that the U.S. Senate committee investigation, according to that, said that United Health is aggressively gaming Medicare Advantage to inflate its reimbursement from the federal government. They are the parent company of Optum. So my question is, what safeguards are put in play in all of this work that we, as a legislature, as the public, can have trust in the work that is happening here when we can also see that the parent company of Optum is under investigation for similar fraud?
Who would like that? Director Conley.
Chair Schomacker, Representative, I think where I'd start is that with respect to fraud concerns, there's an analysis being performed as a deliverable for the department, and we are reviewing that, and any actions that are taken as a result of that are in the department's discretion. So I think to the degree, again, that we are reporting different results of what's being done, and we can report those to you, certainly we will. We're reporting them to CMS as well in terms of results of enhanced prepayment review and how we're making different decisions about policy changes affecting the benefits or the services and the people served in the program. We'll certainly have to report all of those to you, and we should and need to. So I think that's a way that we would remain in contact with you all and provide updates about how the work of Optum in partnership with us is being implemented.
Representative Frederick.
Thank you, Mr. Chair. Another thing that we've been talking about a lot is the analytics. I think Representative Hicks did a really good job expressing the concerns that we have with the analytics. You've said repeatedly that the analytics are changing, they're evolving. You've used a lot of different words to describe that. Could you briefly inform the committee about what are some of the ways that they have changed? I imagine there's probably small changes. There's some, I would assume, larger changes. Can you give us some examples of what has changed over time?
Director
Sure.
Conley.
Oh, sorry, Chair. Chair Schomacker, Representative Frederick. So a couple of things. I'll just say the first thing, I just had a late-breaking thought with respect to your last question, and then I'll get to what's changed. So the other thing that we will do with our finance and analytics teams is replicate the analysis as well. So I think that's a way for us to understand more deeply what the analysis is doing and to understand how results were arrived at. So that's another thing that we'll do, and certainly be in contact with you all about that work. We'll also have a competitive RFP for a longer-term vendor for this work as well. The initial contract term for Optum is a year, so more to come on that. With respect to the changes that have been made to the analytics, so first of all, there were certain analytics that were not as a result of direct policy frameworks that we have either within the programs or in state statute. There were other kind of indicators of risk, so to speak, that were in the analytics. At this point, we're only applying the direct policy analytics that reflect, again, what's in the provider manual within state statute and rule. So that was one adjustment that we made. And I think in addition to that, if there were certain analytics that we felt needed to be tweaked a bit to align tightly with state policy, we made those changes. So if there were different thresholds above which, I think to Representative Hicks' example, where claims were flagged and the policy teams felt that those needed to be adjusted, we've made some adjustments in that regard. So that's one example.
Representative Frederick.
Thank you, Mr. Chair. So then my next question is, we don't know what's all in the report, right? Representative Backer was very quick to show all of the redactions in it. But then my question is as you're making all of these changes, when was this run? Like, does it reflect accurate information? Because if you're needing to change the analytics, then would that not imply that maybe some of the information in this report is inaccurate?
Director Conley.
Chair, Representative, so it is a first iteration, a first pass after 90 days of work. So we are trying to refine the work, the analytics, the recommendations to make them ever more accurate. It's a continuous improvement process. So was everything in the report perfect? No. I think the department and Optum would say this is a work in progress. And again, we're continuing to refine the work. We're 5 cycles in terms of the enhanced prepayment review process. We're working on the recommendations, and we'll refine those as we learn through this process. We're crawling, we're walking, and then we're running.
Representative Frederick.
I guess I'll just close with a comment saying that I'm concerned then that if there is inaccurate information in this report, if decisions will be made based on the inaccurate information, and how will Minnesotans be affected by it. And I think that should be something that concerns everybody, and I hope that there isn't harm. Thank you.
Thank you, Representative Frederick. Members, we have 35 minutes left for this hearing time. I have Gilman, Fisher, Franzen, Keeler, Murphy, Vernig, and Knutson. And you all tabled one of my bills, so just to give a little perspective. Representative Gilman.
Thank you so much, Chair. Question to DHS or Optum, whoever wants to take this. So if a fraudster that has been a provider were to change their billing patterns right now, today, significantly, like if they either did fewer claims or no claims, changed the hours, that was one pattern we talked about, in the prepayment review period, would that review, would it be flagged then? And were there instances of this already? Thank you, Chair.
Director Conley.
Chair, Representative, so I want to make sure I understand the question. So you're saying from prepayment review cycle, like the 2-week cycle, from one to another, if there's a change, would that be detected from one cycle to another?
Representative Gilman.
Yes, or even like a longer period. Any pattern changes.
Director Conley.
So I'm going to venture an answer here, and I might refer it to my colleague here at the table. Chair, Representative, so it depends on what the analytics do, what they are intended to flag in terms of concerns. So if there's a trend in billing, a change in billing that the analytics are activated by, so to speak, or that they're designed to catch, then those things would be flagged. But the analytics are doing what they're programmed to do. And I might pause and allow for supplementary feedback here.
Mr. Dreyfus.
I think that's a very good explanation, and there's kind of 2 camps of analytics or 2 buckets of analytics. There's the policy rule specifications that we've talked about, and then there's the excessive behavior specifications. So if somebody is modifying the behavior, the analytics can be adjusted, or they will also detect behavior changes and determine whether those could be in line with a normalized or normal change in behavior, or if there's still an outlying dimension to it. So the answer is it depends, but that's how those 2 kinds of analytics intersect, the policy rule specification and the excessive behavior specification.
Representative Gilman.
So thank you, Chair. The second part of my question was, were there instances of this in the report?
Mr. Dreyfus.
I can't recall exactly. I wouldn't want to give you a definitive answer. It could be implied in the report, I think. I don't know that we necessarily, and I can't really comment on the redacted sections of the report either.
Director Conley.
Chair, Representative, what I can say is that our own internal analytics that we're engaged in, both on the OIG side, but also within the policy areas, do look at things like that. So we are tracking spending trends. We're looking at provider location and concentration. We're looking at a variety of things that could be indications of problematic activity.
Representative Gilman.
Thank you, Chair. I'm going to just flip over really quick. I'm just going to use another example, and this is a question to DHS as well. We've heard a lot about related conditions in EIDBI. And for me, I am digging more into it. And I know I can go online, and we've seen things already that there's many different related conditions. I still don't have clarity on that, and I can take that offline to get to other people's questions. But I'm curious if there's unique codes for each related condition, and is it possible that the 90% of Medicaid funded, the fraud piece that was discovered here, that there could have been poor coding on each condition? Was there a code for that? Or are these programs too far gone? Like, that's where we need to know this stuff. Thank you, Chair.
Director Conley.
Chair, Representative, that's a very good question. So the answer is yes. every person in the program that receives the service needs medical necessity for the services Representative Hicks pointed out. So there is a diagnosis associated with the billing, and there are specific billing codes associated with each of the services, the 7 services, for example, included in the EIDBI benefit. So we know both of those things on the claim. In addition, what I'll say about the 90% figure again, there were non-policy analytics that were applied in terms of thresholds that were looked at there that flagged the different claims included in that 90% with EIDBI. So again, that doesn't mean those claims were fraudulent. It means that they were flagged for a further look, further scrutiny, because they were above certain thresholds. And I don't want to get into further detail, again, just not to provide a roadmap to folks so they wouldn't be detected if they're doing something wrong. But that's where the large share of the claims is coming from. And I think, again, when you have 9 out of 10 claims being flagged, it makes it harder to be more granular in the analysis. So we're refining the analytics in that regard.
Representative Gilman.
Thank you.
Representative Fisher.
Thank you, Mr. Chair. One of the things as I've listened to this discussion and the questions, it's always important that we're making sure we're detecting and addressing fraud immediately, and at the same time making sure that we're taking care of our most vulnerable citizens. It feels like, in some regards, what I'm seeing here and hearing here today, we may have failed on a number of issues. And the reason I'm saying that is, first of all, taking a look at the report that was given out to us, there's a lot of questions out there. You're hearing things coming up as well. We kind of looked at the policy, kind of not. We've got AI being used. There may have been things that are flagged in here that probably are actually things we should have been paid. And as a result, I've got a lot of questions about the validity of the report. And I think this is only one step in the process, I will acknowledge. Where I think the proof in the pudding comes out is having a follow-up report saying, out of things that were flagged in here, what percentages actually turned out to be legitimate and paid for, what percent are still being investigated, and what percent fell into the fraud, waste, and abuse. That kind of gets to the AI situation, et cetera, and then also being able to take a look at the underlying policies out there. The concern I have is because of the way it feels this has been handled with it being rushed, we have cast a negative cloud over these services, which in turn casts a negative cloud over all of the providers, many of them who are legitimate providers providing legitimate services. And we know over time we've had people who've lost services who should never have lost their services because of how this has been handled. This is where my frustration is with how this has been carried out by the administration. And it needs to be corrected. We've got to learn and do better from it. The question I have in short order is, when will we have the follow-up report to this, showing out of everything that was flagged here, what percentage were found to be okay to paid, what's still being investigated, what percent was determined to be fraud, waste, or abuse?
Director Conley.
Chair, Representative, appreciate the comments and the question and agree fully with you about the various elements of your comments ahead of the question. I think we certainly are striving to protect people while enhancing program integrity. And with respect to how we keep you updated about the different actions and the results of the changes we've made to enhance program integrity, we owe you all of those data, whether it's the number of open investigations from the Inspector General, whether it's claims that were denied, claims that were referred to, or providers that were referred for investigation, those numbers. Of course, there are some elements that have to remain, confidential, but in terms of overall numbers, we can absolutely report to you broadly the impacts of the different changes that have been made with enhanced prepayment review, the shares of claims that were characterized as flagged, followed up on with providers referred to OIG, et cetera. So all of those things, I think we will provide to you all in regular cadences.
Representative Fisher.
Thank you, Mr. Chairman. Thank you, Mr. Connolly. I appreciate hearing that you're looking forward to letting us know that. It'd be nice to know a time frame for that, number one. And number two, as one of my colleagues referenced earlier, is making sure that this is public so that where there were clouds cast and there shouldn't be clouds, that's getting cleared up in the process. Thank you.
Thank you. Representative Conley, any response to that, or?
No, thank
Very
you,
good.
Chair.
Representative Franzen.
Thank you. Okay, thank you here. Not sure who wants to answer this, probably Optum, but I'm just curious, how did Optum identify the avenues of Medicaid fraud when, within DHS, when DHS and all its decades of operation were unable to figure out how fraud is happening?
Mr. Dreyfus.
These 14 programs that are in scope for the work that we are doing today, we're sharing those results with DHS and, working with DHS to provide that related information. The work we undertook is not a fraud investigation, and that's a different type of work activity and not within the scope of the contract, so we wouldn't have an opinion on that right now.
Representative Franzen.
But you identified ways that money could be leaving programs, correct?
Mr. Dreyfus.
Thank you for your question. So the way the scope of the work is undertaken is we're identifying potential indicators of anomalous behavior. It could be, I think we're hearing the word fraud a lot. It could also be waste or abuse or things like provider training or lots of other things in the system that would relate to that. So we flag, using that analytic process, we said we flag those and we share it with DHS and we work through the refinement processes was articulated earlier. So within that process, that's how that works. It could be any of those things, and that's why DHS has shared that information and follows up accordingly.
Representative Franzen.
Right, I understand what you're saying, but what I'm trying to get at is were you able to identify some anomalies where DHS has been in operation for who knows how long and haven't been able to identify those same trigger points that Optum did within, 90 days or whatever it was?
Yeah, I would have to defer to DHS.
Mr. Dreyfus. Mr. Director Conley.
Chair, Representative, it's a good question. And I think what we've said many times is that DHS, to your point, throughout the decades of its existence, had certain tools it was using that were tip-based, reactive, to respond to fraud or program integrity concerns. Those tools, we've said repeatedly, were not up to the task of the increasingly sophisticated fraud schemes that we have seen in more recent years. So we fully agree that those tools were inadequate, and that's why we're engaging other partners here or vendors to help us with that and to pivot to a more data analytics-based approach where we're looking proactively at fraud, looking at trends, looking at different concerning billing patterns, in addition to stopping money from going out before it's paid to a fraudulent actor. So we're doing things differently and more proactively, but would agree that the tools we had were not up to the task.
Representative Franzen.
Thank you, which brings me back to the years that this committee has attempted to stop fraud, and had we actually taken it seriously and not did like, oh, look at Operation Switch Watch. Look at this wonderful diagram that we have of how we're going to stop fraud. If this happens, we move to here, and then we move to here. I've sat in those committees with Jerry Kerber. Those are not fun meetings, let me tell you. And here we are, okay? Here we are again, talking about the same issues that should have been solved many years ago. And now you're like, well, it's all reactive. We didn't have anything that was proactive, be able to stop it. It's all reactive. When we've been trying to get proactive things passed, and apparently, from what I'm hearing, is that DHS didn't like any of the Republican proposals, but that's another conversation. So how can we actually trust that DHS actually wants to stop the fraud when history shows us, or waste, abuse, whatever you want to call it, when history has shown us that we'll just pat you on the head. We'll come up with another diagram of how we're going to stop it. And then we're just going to not do anything about it until more news stories come out. And then I guess, well, we didn't have enough proactive things in place.
Director Conley.
Chair Schomacker, Representative Franzen, I'll make a statement and then I'll kind of talk about the things that we have been doing in the aim of answering your question. Having this job has been the greatest honor of my life.
God bless you.
as a public servant, I take that very seriously. And so making sure that the taxpayer has trust in what the state is doing, what the department is doing, and that people get the services they need, those are things that I carry with me every day. And so as long as I'm in this job, and I know the commissioner feels the same way, and many leaders within the department, we're going to do our level best every day to get in front of this and to solve the problems. We're acknowledging them, we're asking for external input, and we're going to stay in conversation with you all about how to do that. Beyond me stating what my values and what guides me, we've acted. We've taken a number of actions, and we'll take more in the future, again, in conversation with you all, to close the gaps, to do better, and to be more proactive. So what I can say is we're acting now. I've been with the department a little over 2 years, and a good bit of my time there, over a year, has been spent on this primary priority of program integrity. So we'll continue to work on that and continue to do it in earnest and good faith with all of you.
Representative Keeler.
Thank you, Chair. First, I want to just state we are all separate branches of government, and I just want to pause and say thank you to our team. We all go sine-die in May when session is over, and I can tell you the Human Services team in the House of Representatives for the Democratic side has been trying to work on this weekly. Alongside the agencies, we fought for months to get a meeting with our governor because we agree this is an issue and we wanted to dive into it. We wanted to be partners with you, and I just have to say, we did want a hearing in the middle of interim to talk about this because we didn't want to waste an entire committee hearing, but we have real questions that we deserve answers to. And it's crazy to me that some of the things my colleagues have been asking you, you still don't have answers for. Like, we gave you a heads up on some of the things that we have been needing. And to keep coming and being like, we don't have that answer, we'll get it for you later, is just, we're not a team. So I just need to make it very clear that we are separate branches of government, and this team has been working very hard. More than the 20 days allotted we get in the interim to do work. We have been trying. We have been trying bipartisanly to address this. So I just want some answers. I don't want the talk around because a couple of my colleagues have asked things that I feel like we're not just getting a clear answer for. So I know Optum's not going to talk about their own fraud because why would they, right? But I want to know, how did we pick Optum? Was there an RFP process, or were they just handpicked by somebody within the agency?
Director Conley.
So Chair Representative Keeler, appreciate the question. And I'll just say again, it's not our intention not to answer the questions. We will stay in contact with you and try to provide the information that we can as quickly as we can. So I just want to acknowledge that feedback. The second thing I'll say with respect to selecting Optum, there were 4 different vendors that we reviewed in an abbreviated procurement process. So there were different vendors we looked at. Optum was the one that could meet the requirements that we had to do this work. And so that's why they were selected.
Representative Keeler.
In that process, did you take their own fraud allegations into consideration?
Director Conley.
Chair Representative, we looked at the totality of the information that we had.
Representative Keeler.
I feel like that wasn't really an answer, but this is, okay. So also, Representative Curran asked a good question that I would like a follow-up on. The governor's team was very quick to do a press release naming these 14 programs when they were high risk. This is not trust, this creates a fear within our communities. And so when we asked you, when these programs then are no longer on the high risk, is there going to be some sort of public information that's shared just as quickly as the press release that came out of the governor's office when we had high risk? Can you answer us a little bit more specifically on how will the community know very broadly when a program has moved off of the high risk list?
Director Conley.
Chair, Representative Keeler, and I'll also speak a bit to the earlier comments from Representative Fisher in the response. We will be delighted to announce that we feel confident that we can remove programs from the high-risk list. If we have data and processes and controls in place that show that they are no longer high risk, I think that's something we absolutely would want to say very publicly in a press release with as much enthusiasm. And the other thing I just wanted to say, also reflecting on both your question and the prior comments from Representative Fisher, is we understand that this has been difficult for providers. We are trying to stay in contact and receive feedback from them. And the ultimate goal here, understanding that the vast majority of providers are doing wonderful work in our program, that they are serving people in wonderful ways, providing life-sustaining, life-saving, life-changing services. We know that to be true. However, at the same time, we have found through our own investigations and data analysis, there are providers that are committing fraud. We've seen those results of different legal proceedings. So we are trying to build confidence through these actions, and I take the feedback from the members here, build confidence in the provider networks. That is one of the main things we are trying to do, to say, after these processes, after these enhancements, after the work of revalidation, for example, that's happening from now through May, we are trying to say to the public, our provider networks are strong. We have really addressed this problem assertively. So that's really the idea behind the work.
Representative Keeler.
I'll let the other members ask questions. Thank you, Chair.
Thank you, Representative Keeler. Representative Vernig.
Thank you. Director Connolly, earlier you listed who has seen the unredacted, and there was a name missing, and I just would like to clarify. Have you seen it?
Director Connolly.
Chair Representative, yes.
Representative Vernig.
Thank you. Sorry. I know you're tasked with responding to the feds in the robust report, and I was like, wait, if you haven't seen it, I would be a little concerned. I do have another question, just process-wise. Were the policies that were used to build the analytics from your department reviewed before sending them over to ensure compliance and alignment with statutes?
Deputy Commissioner Connolly.
Chair Representative, yes. So we had been looking at those different analytics within the 90-day work period that we had before the results were released. So we had been in conversation with Optum, and CMS directed us to provide a copy of that report by February 1st. So that was part of the time frame involved in releasing the report when it was released.
Representative Vernig. Okay, thank you. Representative Knorr. Chair Knorr.
Thank you, Mr. Chair. I don't know who will take this question. So the initial phase of the Optum report was based on model training for the AI. Is that correct?
Mr. Dreyfus.
Thank you for your question. It was, phase one is a post-pay review, so we take the previous about 4 years of data and we go through it. I would not classify it as a model training per se. It's training the process or informing the process that we're going to follow with DHS and start those cycles and work through it. So it's the first step in setting up phase two, which we're now in, which now is the prepayment review, which will go on the 2-week cycles that were discussed earlier. So it's a post-pay review to get the process started, to then move into the phase two, which is now the prepayment review tied to the warrant cycle.
Chair Knorr.
Thank you, Mr. Chair. I think that's what I'm getting to. The 46 months, which was post-payment, because we put a lot of tools in the toolbox, including bipartisanship, that we put the prepayment last session so that we can get the results that we're looking for. So the 46 months prior is more about post-payment. Did you apply the 192 analytics that you'll be using, the full analytics?
Mr. Dreyfus.
The total number of analytics is not exactly that number. Process-wise, that is correct. So we use the phase one work to develop the analytics that we're now using in the prepayment reviews for phase two. That's correct.
Chair Knorr.
Mr. Chair, thank you so much, Mr. Dreyfus. So to me, that was the training process, because our intent was to do prepayment review, meaning that anything that was flagged during the post-payment there was no follow-up to make sure that the policy and the procedures that exist were not looked into by someone within the agency to say, oops, this is something that needs to be fixed. But you continued to fix it as you refined for the prepayment process.
Mr. Dreyfus.
The first part of your question, I'd probably defer to the Deputy Commissioner.
Deputy Commissioner Connolly.
Chair, that sounds correct. So there were certain adjustments that were made in the 90-day period preceding the release of the report and providing it to the Centers for Medicare and Medicaid Services. But we're continuing to make adjustments based on policy features that we feel need to be reflected or different analytics that we're holding on for now and will readdress in terms of how we want to flag claims going forward.
Chair Noor.
Thank you, Mr. Chair. So trying to flag that whole process because we're trying to get into a system, which claims editing system that is going to be more based on robust process. Because right now we have an overlaying process within our MMIS editing system, which was supposed to catch up with everything. So meaning that we're trying to improve our systems. At the same time, we're using a tool. And thanks for making the changes whereby everything is housed within DHS. The systems are not given to Optum or any outside entity. So coming to that question, we don't have much time. Based on what you have told us today, Deputy Commissioner, are we going to be able to see the results of the unredacted, which are not based on trade secrets, nothing about protected data, nothing about private data that is included in there, so that we can do our job in terms of looking into ways that we can actually bring those savings to fruition? Will there be a possibility whereby we can be able to see unredacted documents so we can make decisions necessary to move forward?
Deputy Commissioner Connolly.
Chair, absolutely. I think once we have an idea of what changes we need to make, and particularly the changes that we need to make to statute or in partnership with the legislature, we will provide that information to you. And I think, again, we'll take another very close look at the report, the vulnerability report itself, and share what we can with you in accordance with the Minnesota Government Data Practices Act.
Chair Noor.
Thank you, Mr. Chair. Just to that effect, what portion of the report was based on policy versus oversight failures?
Deputy Commissioner Connolly.
Chair, I would need to consult with folks back at the department to get you an answer about the share of redactions that were related to, well, what I can say, actually, I can give you some outlines. The security data provision in the Minnesota Government Data Practices Act was what resulted in the redactions in the vulnerability report. The systems edits report that's where some of the proprietary data was with respect to Optum's work.
Chair Noor.
Thank you, Mr. Chair. My final question, given that we do have House File 3378, and I'm reading the second portion because it's considered private data for the agency, but when it comes to us, it's public data. Given what is written there, do you have any problem with that language?
So I think the main line in here is that it only references proprietary. Oh, I'm sorry, Chair. Got to keep my hygiene up there. It only references proprietary information, but I guess there is a reference to law, otherwise as statute dictates. Obviously, if there's proprietary information in the report that has to remain redacted as a result of the Minnesota Government Data Practices Act, it would remain so. That's my read.
Chair Noor.
To me, you'll be fine if this bill moves forward, so you don't have any position for this bill to move forward.
Director Grom.
Mr.
Welcome to
Chair.
the committee. Please state your name for the record and present your testimony.
Thank you. For the record, Christy Grom with the Department of Human Services. Chair Noor, we are reviewing this language. We want to be as transparent as possible. Of course, the legislature determines what is considered non-public data. So I think we are reviewing this language and would like to continue to work with you and Chair Schomacker to get to something that would be workable. So we don't have a position, an official position on this language, to be clear, but we do want to make sure that we're providing information to the legislature that is helpful so it can inform your policy decisions, but that we're not releasing information in a way that would conflict with current law or create security issues for the state.
Chair Noor.
Thank you, Mr. Chair. I look forward to more conversation, robust conversation in how we can tackle what is in that report and also have policy positions that we can bring forward as soon as possible. So thank you, Mr. Chair.
Thank you, Chair Noor, with that. And thank you to the members today for robust discussion on this. If I got anything out of what we had today and kind of walking back or thinking at a higher level is that the department really just, you don't know what you don't know for a lot of this. And especially if the fraud cases are becoming more sophisticated, you really don't know what you don't know. And this was an effort to try and identify those things that you don't know. And it may be that some of the numbers or some of the calculations are being interpreted in ways that was never intended to be that way. These are it's more modeling than it was anything else in that. And I guess that would be my final comment. If I'm wrong with that, please correct me or we'll let that. Okay, very good. Then the committee thanks you for your time today, and we still have 4 minutes, so I'm going to try and get this bill out of here. So with that, then, I am going to grab my Trapper Keeper and move that House File 3378 be removed from the table. All those in favor signify by saying aye. Aye. Opposed, same sign. The House file is off the table. Any discussion to House File 3378?
Mr. Chair, I just wanted to make a clarifying.
Chair Noor.
We did not officially table the bill, so I don't know whether taking from the table. If anybody can, from nonpartisan staff, there was no motion to table. We just postponed the discussion.
The chair is a very powerful position, and the chair just tabled it. According to Masons here. Representative Curran.
Thank you, Chair. I look forward to the vote.
All right, with that, all those in favor, I will renew my motion that House File 3378 be re-referred to the Committee on Judiciary, Finance, and Civil Law. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion passes, and House File 3378 is referred to the Committee on Judiciary, Finance, and Civil Law. That concludes our agenda for today. We all get to be back here at 8:15 tomorrow morning. Anything, Chair Noor?
We've got 3 bills tomorrow, so be ready. Thank you.
Thank you. With that, we are adjourned.